Hello, good afternoon friends. I am Dr. Nitin Patki, interventional cardiologist working at Jupiter Hospital, Joshi Hospital and Mangeshkar Hospital, Pune. Today being World Hypertension Day, I take this opportunity to have this dialogue with you. Hypertension, as you know, means high blood pressure or uncontrolled blood pressure, which is a very important risk factor for developing all vascular diseases. Vascular diseases means blood vessel diseases, which for you it will mean something like a heart attack or paralysis attack or having pain in the legs because of less blood supply. So all these complications happen when the blood pressure remains elevated for a long duration of time, and this is something which is entirely preventable or avoidable. So as I mentioned, blood pressure is a very important risk factor, and that compounds the risk of other things like diabetes or smoking and other things. So to control this, we have to keep checking the blood pressure. As you know, the blood pressure is also called as a silent killer because we will not have any symptoms or you will not feel anything even if the blood pressure is elevated. So therefore we need to keep checking the blood pressure intermittently, and many times during health checks or incidental visit to the hospital, we find many people have high blood pressure. So once you are detected with blood pressure, we will put you on the medications to control the blood pressure. But it is important that blood pressure remains under good control for most of the day, every day. And how will we ensure that? For that, you have to be a part of your own health, and you have to keep checking your blood pressure at home. So this is called as home blood pressure monitoring. It is a very simple thing, very effective thing, provided it is done correctly. So I will just give you a few tips how you can control the blood pressure or keep checking the blood pressure at home. First of all, you will have to use a proper cuff, the BP cuff, which is going to be around your upper arm, has to be of correct size. So blood pressure cuff should be good, proper sized. It should be completely free of air or emptied of air before you put it in, and when you are putting it on your arm, there should not be a cloth over which you are putting in the blood pressure cuff. So this is important how you should be putting that blood pressure cuff. Then secondly, when you are taking the blood pressure readings, you should be comfortably seated. So your arms and body should be completely rested. The feet should be flat on the ground. You should be relaxing for about 4 to 5 minutes. And you should be free of conversation or having a cup of coffee while you are doing this. So whenever you are taking coffee or some stimulants, or you are having some argument or some conversation, the blood pressure is likely to be unrealistically high. So you should avoid that. And whenever you are checking the blood pressure, you have to be absolutely relaxed for at least 5 minutes and record the blood pressure for 3 to 4 times without looking at the pressure monitor what the blood pressure is. So many of the machines have this automatic recording facilities where the machine will automatically record the blood pressure for 3 to 4 times. The reason being, all these automatic machines do have some variation in the blood pressure, and what you are supposed to do is that take the average of this all these readings, and that should be the right reading. So you should be sitting comfortably, use proper cuff, use proper way to apply the cuff, and make some additional readings so that you can take an average. And you should be doing these blood pressure recordings different times of the day, so we know what is happening all 24 hours of the day. So at least when you are waking up, you should not take the blood pressure by putting an alarm and waking at night and checking the blood pressure. So that gives us an adequate idea how the blood pressure is controlled over 24 hours, and that is going to help you in a long way to control your blood pressure and in effect checking or avoiding the vascular problems. Thank you for listening to these instructions. Thank you.